Very nice to see everyone here today. Hello, everyone, and welcome to our second webinar of our webinar series entitled Thriving in Safety, Advancing Adolescent Health and Rights and Ending Gender-Based Violence in Central and West Africa. Je m'appelle Montasser Kamal, je suis le directeur de la division Santé mondiale.
I am in charge of the international development, and I will be the co-chair for our webinar together with my colleague who will join us later, Marie-Gloriose Ngabir.
IDRC's head office, where I'm located and we're speaking to you from today, is situated on the unceded territory of the Algonquin and Anishinaabe people, whose stewardship of the land and waters we now call Ottawa dates back to time immemorial. Plus de 370 millions.
We had 370 million young ladies, which is 1 out of 8 women, which have had a sexual violence, according to our estimations for the UNICEF that we have received till today.
And rights are interconnected issues affecting millions of adolescents in sub-Saharan Africa, and the suffering continues. Les statistiques sont alarmantes. Près de 39% de filles sont mariées avant le...
% of young ladies are married before 18 years old. 95% of them in certain countries are having mutilation, genital mutilation, and more than 70% declare having domestic violence, and more than 90% are victims or sexual harassment in the conflict areas as well. And this is extremely important as well on the territory.
That severely impact physical, mental, and social health and education and economic opportunities for girls and women. Adolescents often lack access to comprehensive sexuality and reproductive health and rights and care and services such as contraception, safe abortion, maternal health, and HIV prevention. Despite the urgency, adolescent sexual and reproductive health and gender-based violence are neglected and under-researched in Central and West Africa. More evidence-based, context-specific knowledge and effective policy dialogue are needed to address these challenges and protect adolescent girls. In its 2016 to 2030 health strategy, the African Union prioritizes access to contraceptive, integrated sexual and reproductive services. On the occasion of the 30th anniversary of the International Conference on Population and Development, the ICPD Program of Action, the IDRC started a series of webinars on the intersection between gender-based violence and sexual and reproductive health and rights in Central and West Africa. Le premier épisode de la série a eu lieu en juin et a fourni une vue d'ensemble du portrait régional de la santé et des droits sexuels et reproductifs des adolescentes et des violences basées
of adolescents and violence based on young ladies. So we have been dealing with all these topics as challenges and opportunities to have progresses on those rights for teenagers and also on health and violence. So everything which is connected to sexual reproductive health and rights, as well as gender-based violence. So if you wish, you can, of course, write your questions on the chat.
Is taking place today and is focusing on the role of gender transformative and action research in informing strategies to tackle gender-based violence and advancing adolescent sexual and reproductive health and rights. For IDRC, gender transformative research and approach aims to challenge structural barriers and societal and cultural norms that perpetuate gender inequality. It promotes structural change, intersectionality, and inclusive participation, focusing on long-term gender equity. The approach that we take addresses the root causes of disparities and supports sustainable and equitable health outcomes. This type of approach emphasizes the creation of inclusive knowledge to inform evidence-based policies. So today we're focusing on three main points. First, exploring how high-quality transformative and action research can inform evidence-based interventions to advance adolescent health and rights and end gender-based violence in Central and West Africa. Second, focusing on sharing successful strategies and best practices in terms of research, advocacy, and policy engagement that have contributed to tackling gender-based violence and advancing adolescent sexual and reproductive health and rights in Central and West Africa. And third, finally, and focusing on discussing the lessons learned and challenges faced by research grassroots organizations, health sector, and policy actors in implementing and scaling up effective interventions for gender-based violence and adolescent sexual and reproductive health and rights in Central and West Africa. To walk through these objectives, we will start with a 5-minute video on which focuses on empowering girls in Togo through sex education. Then we will have a panel discussion with 2 rounds of questions with 5 invited experts, followed by a Q&A session and some closing remarks. So let us start and enjoy the short film first before we move on to our panels.
Il est important pour moi de rester en contact avec la culture Tambarma pour bien comprendre, pour mieux connaître comment nos anciens vivaient et pouvoir moderniser ça de nos jours. C'était à l'âge de 17 ans, en classe de seconde, que j'ai rencontré un gars. Jusqu'à je suis tombée enceinte. Cela m'a beaucoup énervée. Je ne pouvais pas continuer les classes. quand j'étais tombée enceinte. En lisant les visages des gens, j'avais perdu toute la valeur pour la communauté. Mes camarades de classe m'ont tous abandonné. Ils ne veulent même plus apprendre avec moi, même marcher ensemble. Bien qu'une partie de la communauté m'a abandonné, mes parents ont été un soutien pour moi. Ils m'ont soutenu à continuer bien les classes et oublier les on-dit. Une des personnes qui m'aide dans la communauté est Madame Baliba Pati. Elle m'a aidé à travers ses sensibilisations à l'école, m'a aidé à prendre conscience et être la meilleure de la classe.
J'accompagne l'équipe, l'association togolaise pour le bien-être familial, à sensibiliser les jeunes par rapport à la prévention des grossesses précoces. La TBF apprend aux jeunes à se protéger, par exemple l'abstinence sexuelle, des rapports sexuels protégés à travers beaucoup de méthodes. Concernant les grossesses précoces, surtout en milieu scolaire, vraiment ont beaucoup d'inconvénients sur la personne. Il y a la honte, l'abandon des classes et discriminé dans notre communauté. Également, c'est une perte dans la société puisque les femmes jouent un rôle très important dans notre communauté. C'est elles qui s'occupent de l'éducation des enfants, la santé des enfants et contribuer au développement de notre pays. À travers les sensibilisations, les leaders communautaires, tout le monde se donne pour sensibiliser les jeunes dans la communauté.
Alors, lorsqu'on parle de planification familiale, les problématiques de grossesse précoce sont très alarmantes. À l'âge de 12 ans, j'ai connu le mouvement d'action des jeunes, où les jeunes filles de mon âge sont confrontées à des grossesses et à des mariages précoces.
De la santé de la reproduction, tu as une idée de ce que c'est?
Non. La responsabilité en éducation sexuelle incombe à la fois à l'homme et la femme parce qu'ils sont des acteurs cruciaux dans la vie des enfants.
Nous avons espoir qu'un jour, ce phénomène va cesser et nous aurons des femmes battantes qui auront à occuper des grands postes et ça va éviter la pauvreté et il y aura la paix, la cohésion sociale dans notre communauté.
Si je ne continuais pas les études, je devais devenir une charge pour mes parents et je ne saurais comment les aider dans le futur.
Et les études et l'enfant.
Mon rêve est de devenir une sage-femme. Après le lycée, je vais continuer mes études pour devenir une sage-femme.
Thank you very much, Catherine, for projecting the film. As we can see, many dreams our girls have many dreams, and many of those dreams can be sidelined by neglect and absence of attention to their rights, sexual and reproductive health rights, and protecting them from gender-based violence. So I hope you appreciated how important such initiatives are to transform the lives of girls, as is the case of Pauline's life, and bring promise not just only for the individual girls and communities, but also for entire countries where young people and young girls in particular are being subjected to those violations. It's now time to start our panel discussion. Ramata Tioni and Francine Senzenkayo are the moderators. They are both IDRC senior program specialists, and they are based in Dakar, Senegal. They are so passionate about these issues, and they are going to present an excellent panel for us, a panel of experts for us today to discuss these issues and present these examples. Ramata, the floor is yours. Thank you.
Merci beaucoup, Montasser.
Thank you so much, Montasser. Can you hear me? Yes, we can. Great. So yeah, thank you so much. I will now ask our panelists to switch on their cameras and to tell you that I'm extremely happy to have you here. It's a great honor. So I think we all have our cameras on. Thank you. So as said, I would like to start with the introduction of our panelists. So first, Fabienne Inagrand Sania. So
Officer and Principal Health Research Officer at the Ministry of Health in the Gambia. She is also the principal investigator of an IDRC-funded research project strengthening access to quality comprehensive education amongst and in and out of school adolescents in the Gambia. Chère Fabienne, welcome, bienvenue. Je vais présenter.
So now we have Dr. Jacques Emina. So you have the founder of the Institute of Research for the Population and Health in the Democratic Republic of Congo and advisor in dynamic of populations and policies for the United Nations for Populations to the Regional Office for West Africa and Central and Western Africa. You represent that project financed by IDRC around the socio-cultural and sexual violence and also in Democratic Republic of Congo. So very welcome to you, Dr. Emina. Now we have Dr. Natalie Swadogo. You are researcher and professor on demography at the Superior Institute of Science and Population, ISSP, University of Joseph Kizerbo. And you were the main researcher on a project financed by the IDRC, answering the sexual violence of adolescents, teenagers in Burkina Faso for the respect of their rights, sexual rights and reproductive rights. So very welcome to you as well. Dr. Mariatem, so very welcome. You are the chair of the International Center of Research and Training, ICAT, associated to the Pansy Foundation created by Professor Denis Mukwege, the Nobel Prize, and of course obtained in 2018. And she has been the professor to the Public Health School of University of Montreal and also the director of the Observatory IGEA to support optimization of French-speaking women for health and responsible for all the Queen Elizabeth for the reinforcement of research and on health for CDAO and RDC. So, Dr. Atem, very welcome to you as well. So now we have introduced everyone, and I would like to ask our panelists to share their perspective. Of course, we have some questions here and some topics. So we'll start with a first round table, and for each of our panelists, you can, of course, share those points for a maximum of 4 minutes, please, in order that we can cover all the topics and ensure as well interaction with the audience. So I have the first question for Fabienne. Fabienne Grant Sania. So Fabienne, could you
research project used to strengthen access to quality comprehensive health education among adolescents in the Gambia in 4 minutes?
Thank you very much, and good afternoon, everyone. When it comes to the strengthening access to quality comprehensive health education in the Gambia, In the Gambia, adolescents in the Gambia are faced with limited access to quality comprehensive education despite the presence of numerous policy frameworks and interventions. So we have about 43% of the Gambia, less than 15 years, they are 43%, and approximately we have 55% of the population which is under age 25. So we conducted a research what various strategies were used successfully. Initially, we included involved the First Lady of the Republic of the Gambia to launch the project for us with other line ministries, this Ministry of Education, Ministry of Health, Ministry of Youth and Sports, and also the communities and students at large. So what we did was we conducted a mapping. We had a mapping. We went to the different schools that were randomly selected and also the communities because it's both in and out of school. So we had like mapping, and from the mapping, a standard research was conducted and data collected, analyzed, and shared amongst all stakeholders. When it comes to the research, we selected 43 schools, and in each school, we randomly selected 35 students from each school, from junior secondary to senior secondary, both public and private schools, both boys and girls. So overall of the research in the schools, we had about 1,505 students who participated in the research, 126 teachers, 3 from each school, and also 43 school principals participated in this research. Then once we got our research findings, we disseminate widely this research, not only in the schools. We disseminated it during school assembly in all the 43 schools. We disseminated it with the teachers. We invited them to come and listen to the research findings that we got from the research. The school principals were involved. The Ministry of Health, the health workers were involved to listen to the research findings. The religious and cultural leaders also were involved during the research dissemination. The community members, the out-of-school adolescents, the National Assembly also were rich, and quite a number of them came and participated. The media houses, the journalists, the Islamic schools, and also not forgetting the special needs schools, hard of hearing, the school for the blind. They were all involved in this research dissemination. We also protect the radios and television also to disseminate the research findings when it comes to the comprehensive health education. As the comprehensive health education is key and crucial for the school system, a partnership was brought with the schools system by auditing the curriculum and looking at the feasibility of integrating it into the school syllabus and teaching it correctly. So teachers were also trained, and students and members of the communities were sensitized to claim ownership over it. How did we use the schools? We used it through the research findings. What we have got from the findings, we incorporated it, went to the schools and gave each school a topic based on the research findings. It is about menstruation. It is about unwanted pregnancy. It is about STI. It is about gender-based violence. It is about contraceptives. All issues that we found when it comes to the research findings, we give it to the schools. Each school has a topic and organize what we call a drama and a poetry competition, because not all students can understand when you talk, but when it comes to performance, they perform very well and teach each other based on the issues that we have found during the research. So also constant monitoring and evaluative routine exercise were held as well to gauge the level of appreciation and internalization of the comprehensive health topics in the schools. So in the Gambia, why we say comprehensive health education is because it's supposed to be comprehensive sexual education, but each country, they have their own term. They want to use it as their own definition because of the socio-cultural norms that are affecting us. So we use comprehensive health education because health is broader and the word health is accepted by all, but we all know the concept. So all the religious people, they understand and they really appreciated this research. Likewise, the National Assembly also, they appreciated this research. The First Lady of the country and the ministers, they appreciated this research that is funded by IDRC. So everybody now understands this because the teachers weren't taught initially to understand this. What we did was we collaborated with the Gambia College, the only institution that provides teachers for the Ministry of Education. So they train teachers when they become pre-service, so that once they are incorporated in the system, they become in service, they will continue talking about the comprehensive health education, the issues about reproductive health and how it can be incorporated in the school system. So it has broadened a knowledge of a lot of people. The strategies we are used holistically. We use the bottom-top approach, not only looking at the top level people, but we started with the parents, and everybody appreciated this. The mapping that we have conducted when it comes to strengthening access to quality comprehensive education, it widens and broadens the minds of the parents and the religious leaders, likewise the cultural leaders. So this is the approach that we use. This is the strategies that we also use when it comes to the research that was conducted in the Gambia in Region 1.
Thank you very much, Fabian, which is a very insightful comment. Je m'en vais maintenant demander à...
So I would like to ask Professor Dr. Jacquemina, how was your approach, your research approach? How could you highlight those socio-cultural factors which are determining the sexual violence? Yeah, thank you so much. I am Jacquemina, and thank you for the question. Well, that was a research which is still in progress, and we have adopted 7 strategies in order to make, a global research and to have global results and to improve the life conditions of those young ladies. The first strategy is a mixed strategy. We actually put quantitative approaches to quantify the intensity of the children weddings, but also the violences and which kind of violences do we have in terms of percentage. And also we have determined the main factors, the key factors. So we were able to use qualitative approaches, as said. So this means we had individual interviews, but also discussions in groups to go further, to go beyond, those numbers. And that was really important because we had the opportunity to understand why we had certain marriages. So at a certain place, we had to improve this research. So the mapping of interventions and also the discussion with certain parties, and also the review of policies and programs which are already existing in certain countries. So we had a global research to identify where are these interventions in order to have, the opportunity to use it. The third step is a participative approach. That means that you have several participants in all sectors, NGOs, United Nations organizations, but also civil society, because little by little, we wanted to discuss on the method, to find an agreement, to talk about those questionnaires, if they agree with those questions, and then to see the target population. So we organized a meeting allowing us to, change sometimes directions and having some results to be discussed with all the parties together. So that was extremely important as for the method.
Les techniques d'analyse pointues et adaptées aussi qui ont des sens politiques, pas nécessairement statistiques et scientifiques, mais aussi qui peuvent renseigner les politiques pour, par exemple, identifier quelles sont les populations les plus vulnérables et voir, permettre de faire les interventions ciblées. On va aussi faire la triangulation.
We will also go check between those 2 different approaches. We will pull them together, and then of course we will discuss with all of the actors and try to have a synthesis, let's say, to have a holistic view of the issue with everyone that is involved. And then we can have this sort of global point of view. and perspective. The research team is cross-disciplinary. We have demographers, we have sociologists, we have legal aids, and so there are, of course, maybe it takes a little bit longer for the discussions, but in order for the study to be really cross-cutting, it is very important that we have access to all of these different approaches. One more thing that I didn't underline here is that we started with analysis that we already have, the data that we already have from science centers and health centers, which already gave us some ideas about trends and also was able to be fed into our survey in order to see what is actually going on and what is the situation. Thank you so much. This is what we did in the DRC. Thank you so much, Dr. Amina. I will now give the floor to Dr. Nathalie Savadogo. Nathalie, in a few minutes, could you tell us? Yes, I can hear you well. Yes, maybe in 4 minutes, can you tell us how's the research that you have conducted contributed to positive changes in the reproductive health of adolescent girls, and in which way was this strategy different? Thank you, Ramata. Hello, everyone. It's a pleasure to be here today. I would like to remind you that the project that I will talk about took place in one region of Burkina Faso in the southwest, Boubou-Liba province. The aim was to identify a way to respond to violences, gender-based violences against girls. So Jacques said about the cross-cutting approach, and we have something similar. We are trying to reach out to stakeholders in that reproductive health field. We also have experts in the field of response teams and actions in order to safeguard the security of our girls. I would like to put forward here 2 strategies that we have used in order to make sure that our research is relevant but also efficient in order to actually make a difference towards the violences against teenage girls. To build on what Jacques also said regarding his studies, we have this mixed approach in order to quantify the events and actually go deeper in investigations and to understand them better, especially the root cause that might be based in the social economic context, because if you don't go down to the root cause, you might not really understand the phenomena properly. So this research is now stopped. It stopped in 2023 and from 2019. And this formula, let's say, enabled us to really get a baseline of the situation. Then we were able to get the results and actually inform our next actions. And it enabled us to start seeing commonalities, trends, and also how to use the results and how we could actually improve the situation. So 2 main axes that we used. First of all, the participatory approach, and also the taking into consideration the gender-based specificities. It is a very sensitive context that might have worries or blocks, whether it is for the general population or the people who are participating in this investigation. So we had to take the time. It does take a lot of time. We needed to take the time to have a mapping of all the stakeholders, to identify them better, and to make sure we could gather them in the best way. And we also needed to have stakeholders in the government level, regional level. We also needed to have a provincial expert, and um, we had to find a way to gather all these people, whether it is for parents or religious communities. Everyone needed to get involved. This approach allowed us to simplify data collection. It was the first data collection on gender-based violence in the country, especially for such a really sensitive topic such as rape and other violences against teenagers. This process was a co-creative process. The stakeholders we involved actually were the ones deciding on the action plan based on the data we had. This allowed us to have an activity that is sustainable, and it also allowed them to mobilize resources themselves and funding. The second aspect was then to take into account the gender-based specificities, whether it is in research, in the identifying signals, sorry, and also in order to see also who were the most vulnerable groups that were affected by this. I will now stop now, and I'm happy to answer any questions. Thank you so much, Nathalie. Thank you for sharing. We will now turn to Dr. Marie Atem. In 4 minutes, could you please share with us how can your research be used to promote the development of adolescents in all their diversity in fragile contexts? Thank you very much for the floor. First of all, we wanted to develop an action plan. And first of all, we needed to identify the needs. Then we needed to analyze the situation and also draw up a list of priorities. We can call it maybe, let's say, a start investigation. So research really shows us the reality of what the community is living through, and then therefore we can also have targeted interventions. This research needed to be able to highlight the vulnerability context of teenagers and the gaps in their knowledge. We needed to have some information about their vulnerability for example, for forced marriages or for rape, and we had to identify also the socio-cultural risk. We also needed to inform the national policies and improve socio-cultural norms. So all of these, we had to identify all of the blocks. For data collection, we need to be able to defend our adolescents through better education, through the better family planning, but this data collection also needs for all of the young people to be able to emancipate themselves and autonomize themselves, empower themselves. We wanted to make services that are adapted to them, like a holistic vision of the services to give them information. This would be also accurate information about sexual health. So these were made available to them. For example, it also had some information about prevention against STDs and contraception and sexual health in general. Through education with different service providers, we had a sustainable and continuous course, and we also managed to keep the quality of those services top notch, and we were able to deliver accurate information to our teenagers. Lastly, we were able to identify the socio-economic and sociocultural vulnerable traits of these populations. So with some data, we were able to develop some trainings that worked better, and we also had some information about some trainings that were working but that couldn't potentially be put to scale. So we were able to identify and analyze the different training materials. With the ICA Research Center in the South Kivu, and we will launch it in Burundi soon. This research was developed within a project that was financed by Mondial Canada, and it is within the program for girls and women's sexual health and information. So we used the different methods. We had some different structured interviews, discussions, conversations, and also some interventions within the community. We had some different stakeholders. We had men, women, girls, and boys. We had government officials as well, and basically stakeholders from all walks of life. So the kids that we came to our trainings were well looked after by trainers. Then we had a survey, quite a full a very well developed survey with a lot of information. And for example, it had questions about the perception of this or that for girls or boys or within their families. So for everyone, it was a very important information. We had a lot of other things on the survey about the people they would hang out with at school, their type of socioeconomical backgrounds, and if there was a need, we could also go and see if there was a trauma that was identified, and we would be able to go back to that person. There was also activities based on equality within the members of the family and the community. So through this very large coverage for all of these different facts, we were able to analyze the situation in a better way. And now we are able to analyze the data in order to identify priorities on which the interventions could actually take place or be developed if needed. Thank you. Francine, we will go with the second round of questions. I would like to excuse Professor Seringe Mombe. He was part of this panel, but unfortunately, for technical reasons, he was unable to join us. So we hope that we were hoping that after this first round of questions, he would be able to join us, but it's not possible. Unfortunately, he is apologizing for this. So Francine, thank you very much. It is now your turn. Merci. Thank you so much, Ramata. Before we continue with the second round of questions, I would like to prompt our audience to ask any questions that they want in the chat, and we can also just exchange and talk about these questions with our panels. So for the second round of questions, the panelists will have to answer in 4 minutes. And I will start with Dr. Emina. Dr. Emina, could you let us know could you let us know how your research about can you acknowledge how the social to cultural determinants of gender-based violence and child marriage help to improve reproductive health in context of security fragility, for example, in the Democratic Republic of Congo? Thank you very much for the question. There was definitely a national dimension to this study. And let's say that for us, for arranged marriage, it exposes the young girls to a very long period of procreation, of being, so they don't use contraception very well, so they will start bearing children very fast, very early on, and perhaps over 35 years of procreation, whether for another girl who is married maybe at 25 years old, it might be less than 35 years old, much less. So this is associated with some issues. For example, early maternity, early pregnancy can also create a lot of health issues for the children and also for the mother. This can have deadly consequences. Second thing is that the arranged wedding is a block for the empowerment of those women or girls. Those young girls miss on opportunities for labor or for education. They are now unable to access reproductive health services compared to women who are living in better conditions. Aside from this, so we have employment, we have education, and then they also enter a cycle of poverty. So they start procreating really fast, bearing children, getting pregnant. They don't have education, they don't have job, and they might a lot of health issues. These are part of the consequences, whether it is for them or the child. Same thing with gender-based violence or sexual violence that is exposing young girls to STDs. It also poses issues on dignity and human rights, and also mental health issues. Mental health is not a very well-researched field, but if we could analyze the mental health of those young girls and young women in our countries, for example, when we have insecurity due to war in DRC, unfortunately, insecurity is everywhere. We have poverty, we have community insecurity because some practices are detrimental to young women, and there's also climate insecurity. It is really a global feeling of insecurity. What does this insecurity have on their mental health? Sexual insecurity will also have very heavy consequences on those young girls' mental health. Sometimes they have trouble being able to feel free in the community and really empowering themselves to become the people that they're supposed to become. So, to be really precise, we will really target the actions and try to take the problem from the roots, because the preliminary studies that we have led has showed that the main variable is education. Education is the main variable that determines early weddings or marriages. Of course, and then after this you have the poverty. But first of all, Secondary education access reduces the problem and the burden of arranged marriage at an early age. This is why this study is crucial. We also have a lot of information. Sometimes we ask the young girl, where could you declare that you have been assaulted, sexually assaulted? If the little girl doesn't know it, she now has the information. She can go towards an NGO, she can go to a police station. Now, this study will actually give them information about how to improve their sexual health. And it will definitely not just be for those young girls, but also for the women of tomorrow and for the whole community. Thank you so much. Thank you very much, Jacques Emina. And to talk about the different determinants of health, it's also about being able to fulfill yourself as a teenager. So how can we promote this fulfillment for teenagers in their diversity, in their fragile contexts? Thank you. In order to promote the fulfillment of teenagers, the research needs to really shed light on what they are living through in terms of reproduction, health, and rights, as we have mentioned. What happens on site is that when you are part of a big data collection, we have a lot of different concepts. In order to have a large, let's say, data sets, we can feel we can, for example, tell all of the researchers that there's too much theory, there's just too much data, and we can feel a bit swarmed by all this information. So a lot of times, these people are just taken through in this cycle, and we are missing the part of work that comes to analyze those data to actually take out the information that will improve the lives of the people that we are trying to help. To get there, we need to have indicators. In my project, we have indicators, and we are trying to target our research and surveys in order to collect those particular data that are useful, because very often we're actually lacking this type of data. So looking for these indicators is the core of our work. Then the second part is obviously analyzing what the information was brought by the indicators. It is absolutely paramount to put in place. And in my project, we try to go back on the field to work with the teams on site to actually analyze the data and also identify some priorities in order to help the community in the best way. And here we are talking about teenagers, of course. There are different themes for these indicators, but we have, for example, respect of the rights, we have equality, and also women rights. For example, the percentage of girls who are between 15 to 17 who haven't been married or are not sexually active. So we, for example, get this data, and then whenever we get this percentage, we actually don't use it just to put in a report. We have an idea of attitudes towards modern or traditional methods. We see in which way we need to raise awareness towards those issues, and it gives also an insight on how useful or how effective are the contraceptive rights information dissemination strategies are. This helps the service providers to understand the level of need in this context. So we need a factual information in order to raise more funds and resources and help those young children. We also have this percentage of unplanned births. in order to show the consequences of those needs not being met. This so allows us to target the data that we actually collect. We see now the urgent challenges, and often there is a lack of information when it comes to the reproductive rights and sexual health for teenagers, contraception health, and information, of course. There's also a lack of engagement from the youth and maybe a lack for all the service providers in the level of information that they provide to those young people. So we obviously targeting young girls from the age of 10 to 14. There are also different levels of backgrounds, the different levels of education. So we try to really improve all of these. We have There are also national policies that are directing these programs, schools that are pushing these programs as well. So we are identifying all of those different criteria that we need in order to improve the different places where the information is available. So information um, about early marriage and sexual violence, and we need much better information about all of these topics. And through this research and through this participatory research, we can have a lot of answers to a lot of questions in order to have targeted actions that will answer a specific need that will be particular to each community, province, country. However, we shouldn't create a need if there is not an available service able to fill these needs. It is important as well to take this into consideration. Thank you. Thank you, Dr. Atem. Thank you very much for those very important observations, and I hope that we will be able to go back to it in the second part. I will now turn to Dr. Sawadogo. Can you tell us how has the research you have conducted contributed to positive changes in the reproductive health of adolescent girls and their protection against gender-based violence and help them against that?
Juste d'abord qu'il s'agissait en fait.
First of all, it was one of my objectives to make a diagnosis of the situation, to understand how adolescents, young, ladies and boys were living those violences, and also what had happened as answers given as for the prevention, but also how to have this opportunity to propose a model that would be integrated and global. So that would be being more inclusive and also understanding a more linear answer. So as for the intervention, we were talking about how we, had all the actors participating and also answered, proposed solutions. So the model was articulated with three axes. So first, the implementation of social activities. Second, it was a system, which is an algorithm to enhance all those numbers in the province, and also that was done after the analysis of the poor results that we had. And finally, that was the implementation of a permanent committee to give answers on violence, sexual violences, and in order to give more uh, giving more activities and results, that would be probably dealing with their implementation and they had a lot of echo in the press as well, and that was a model. That model was created with all the actors, which, you know, contributed to that. So we had also the opportunity to create a dialogue, and having exchanges with a lot of sessions and teenagers, but also parents of those teenagers, talking about those factors and how we could protect them, protect young ladies, but also young boys from that. And we had to see what happened in the families, inside the families, because, you know, the authors of that violence were part of those families, and, you know, mainly young ladies. So that was a dialogue created in groups, but that we had a great impact. And that allowed us to really reach a greater group. And in fact, we actually deal with, you know, these topics, and we shed light on these specific aspects in order to solve those issues. We also had activities of communication towards boys, young boys mainly, because, you know, one of the main factors is that toxic masculinity, right? So that was also one of our areas, and we had to work on that and also try to enhance that, trying to, of course, give more opportunity and understand why. So the authors probably are not encouraged, but let's say excused, right? So we cannot really solve the issue. So we had this number of activities for young boys in order to really understand how it works and try to see those processes. Of course, it takes a lot of time, of course, and, you know, but little by little you can develop them, and we had positive results starting from those populations. Now, the other key element of the intervention was the fact that, as said before, the algorithm was taken into account to integrate all the actors in order to have this great opportunity to profit from specificities, capacities, skills. And that is, you know, extremely important to put the community in the center of, you know, the topic. So the research actually showed that we had two actually parallel sessions. First, a enhancement which is more familiar, connected to the community, which would probably, you know, see what has been done and probably solve rapes inside the family or the community, right? And it was like a kind of taboo, and solved by the families. But this is exactly what we did. It is the official structures which would enhance those aspects. So health institute, health centers, and that allowed us to really diffuse it. Third, we have an integrated community to make this monitoring on those, you know, issues. And I will stop here. Thank you so much. Thank you. That was extremely coherent. And now let's switch to our analyst, Fabienne.
Adolescents in schools in the Gambia. Thank you. Let me see if I can see Fabienne. I don't seem to see her on the screen. Maybe she has peut-être que notre panéliste Fabienne a des soucis techniques.
Do you have technical issues, Fabienne? So shall we actually switch? Because probably she's disconnected. So I would like to invite our panelists at this stage. Oh, Fabienne, you're here. Hi again.
Yes, now I can hear you. Thank you.
Great. So I have last question for you. Can you please tell us about the impact of your research on school adolescents in the Gambia?
Thank you very much. The impacts are also equally many and various when it comes to strengthening access to quality comprehensive education amongst adolescents in the Gambia. There was indeed a change of attitudes as both parents and teachers broke away from the culture of silence and discussed issues that affected their health. Girls became more bold to challenge the traditional harmful practices, especially female genital mutilation. You all know about what happened in the Gambia when it comes to female genital mutilation. This research have really impacted a lot of girls to challenge the traditional leaders when it comes to the practices. So there were also improved decisions made by girls in regard to early marriage. So they also stand bold because the dissemination reached and touched them. The impacts on the individuals and communities. One, it raised awareness on sexual reproductive health and gender-based violence. The implementation of the comprehensive health education research findings led to increased awareness of sexual reproductive health issues such as safe sex practices, contraceptive utilization, abstinence, and the effects of sexually transmitted infection. Additionally, this program, it has helped to shed light on the effects of gender-based violence and have encouraged individuals to seek support and report instances of abuse by giving them helplines that has been widely disseminated in all the schools. The secondly, also, it has empowered and made informed decision making. So when the dissemination occurred in the schools, the dissemination have empowered both in and out of school adolescents, their parents, and many others to make informed decisions about their health and well-being after providing accurate and age-appropriate information, because the adolescents were divided into three categories. You have the early, the middle, and the late adolescents. So at age appropriate, it makes them to understand very well. Understanding of self also has made a big impact. The comprehensive health education, it has played a crucial role in helping individuals understand their bodies, because hardly parents do explain to the child, explain the girl child about their bodies, the different parts of the bodies, and also about the anatomy. So by providing education on topics such as puberty, children, they became aware issues about menstruation, so because most of the time, sometimes most of them, they lacked sanitary pads. So what we introduced from our research findings, because we have found out that some adolescents, they don't have sanitary pads, they don't have the disposable ones. So we organized by training young girls, training teachers to help them make and how to make the reusable sanitary pads. And now a lot of students are now using it, and it has really impacted their life. Also their reproductive system, how it functions. So through education, it makes them to understand themselves. Awareness of rights. What are their rights? Individuals who have participated, the students who have participated in the comprehensive health education programs, they have gained a better understanding of their rights, particularly in relation to sexual and reproductive health. So this program have also encouraged individuals to speak up about their experiences and seek help when needed, contributing to the reduction of stigma and discrimination. So the most positive impact was developing a wider literature scope of the comprehensive health education. As sex was a sensitive entity, people don't talk about it. The transformation to health brought the religious leaders on board who could have resisted against it. So the comprehensive health education programs in schools and in communities, it have far-reach impacts, from increasing awareness of sensitive topics to empowering individuals to make informed decisions about their health and well-being. So addressing these issues, after addressing issues related to sexual reproductive health, gender-based violence, menstruation, society and culture, self-awareness, these programs have contributed to creating healthier and more informed communities. Thank you.
Thank you so very much, Fabienne, for this rich intervention. So maintenant, je vais inviter les panélistes.
I would like to invite all panelists to answer the questions that we have received in the chat. So we have received a lot of questions. So I would like to ask our participants to continue to send their questions in the chat, of course. If we do not have time to answer all the questions today, we'll have the occasion, of course, to continue our discussions, our exchanges. And I would like to start with you, Fabian. So
schools. What about out-of-school targets? What difficulties encountered during implementation?
Yes, the research, the strengthening access comprehensive health education is in and out of school, because the out of school also, they are very important. We do not only conduct it in the schools, we conducted it in 43 schools and also in 17 communities in Region 1. So we included the out of school. Though in this out of school, we had 40 out of school adolescents, and we conducted the research in the qualitative. So this research was a mixed method, quantitative and qualitative. So it was triangulated. So for the in schools, we used the quantitative approach, and the out of school, we used the qualitative approach, using focus group discussion and in-depth interview.
Thank you so very much. Je vais continuer avec des questions qu'on a reçues dans le...
I've received questions in the chat, and we'll take each question and we need to answer each of them. So the first one, the early marriages are due to what factors? What about your researches? What is the responsibility of parents facing those challenges for these adolescents? So anyone wants to answer this first question? Yes, please. Yes, please, you have the floor. Well, we have several factors, by the way, because the nature of our data will not allow us to shed light on the whole, cause, just because most of the data we have are cross data. So it is, connected to several factors. So first of all, we have education. So sexual education, namely, and education globally. So we have seen that children which are not going to school are more exposed to early marriages first. Second, we have cultural factors. We were talking about identity, cultural identity. We have standards, cultural standards, which continue to think that, young ladies is connected to the family and having children, and that of course means sometimes early marriages. And then we have a third factor which is still dependent on that. It is the early sexuality and also non-protected. So when for young ladies, you have these situations at a certain time, they are sexually active, and at the same time they have not access to contraception in case of pregnancy, right? So that would lead to a marriage, generally speaking. And then you have the parents. And of course, their role is important. And sometimes if someone has the opportunity and can, take the whole family, the new family in charge, and that could, change the deal. So that is, to recap, what can happen. And of course, security is extremely important as well.
Désolée, on est à court de temps, donc je vais...
Thank you so much, Dr. Emina. I will now invite panelists to reply with succinct answers, please. So the second question is, did you have any difficulties to translate the concept of gender in the database and the data collection with the community? If yes, how did you go about it? Who would like to take this? Okay, I will start. So whenever we were preparing the study, the field study, we started of training for the investigators. So first of all, we wanted to know what was their definition of gender. Through some works, we explained to them what it was and how gender can in certain cultures can be, for example, gender like just boys and girls, and then maybe around the world there are very flexible definitions, and it is not easy because whenever you got to use this within a local language with a vocabulary that might be different than the one that we developed the tool in, well, it is quite limited sometimes or more difficult to explain, but we try to explain it in the best way we can in order to give examples. But of course, nothing is really, guaranteed 100% that the concept has actually gone through. Thank you. Thank you so much, Dr. Saradogo. Sawadogo, pardon. Sorry. The last question is for you. Can you also take into consideration the aggravating symptoms or factors, for example, like climate insecurity or things like that? It would be very interesting to see the cause to effect consequences of these factors for teenagers and also according to different communities present in Burkina Faso. Thank you, Francine. I have a comment and a question. I started to have to take into consideration all those different factors in our context, because usually the ones who are the most vulnerable are the ones with the most problems to solve any health issues. As far as our study is concerned, in our province, I could suggest this crisis solution that was quite important whenever we actually developed our research. Was obviously we had terrorism, we had insecurity that was also, of course, affecting people. And there were some zones that weren't so accessible, so we had to adapt. So one way to touch the right people to actually reach the people who need to know about it has to come through the community. The local community will know how to find endogenous canals and channels in order to touch the people that need this information. That's all. Thank you. Thank you so much. I will take this opportunity to thank the audience for their questions. Unfortunately, we had to cut short because of the time we had for us. Thank you very much for all of these amazing observations and comments from all of our panelists. I will now give the floor to Marie Gloriose. I think that we had one last question here. Ramata, sorry. Before we freeing our panelists, I think that I would like to thank them for their high quality contributions to the debates. One last question. In 30 seconds, what is the key message that you'd like to share today on the basics of what we've heard today, and also because of your expertise? For all of our participants today. One message, very fast. Yes, we talk about research, but research doesn't necessarily have good press in some places. sometimes we don't see that it might improve things. I think that it is important to highlight the fact that populations should work in collaboration with the researchers, especially for teenagers. Thank you very much, Dr. Marie. Jacques? Yes, I think we should have a dialogue between the politic researchers and also implementation organizations for an efficient implementation of the program and to improve the well-being of the youth, but also our population at large. Thank you very much. Very good. Natalie? I think that my colleagues also said what was the most important, but I would like to add that without the synergies, those exchanges, thanks to these synergies, we will be able to make things move because we will be able to use those research and the results, and we will be able to together find strategies that might work and be relevant according to different contexts in that field. Thank you. Thank you very much. Last.
Just in 30 seconds, an insight to share with the participants.
Thank you very much for all the purposes of this successful story, and was funded by IDRC, was only confined in region 1, in only one region. So if extended to other regions, because the research was just in urban Gambia, so we want it to go and scale it up to rural Gambia so that the whole nation will benefit from it. And we appreciate IDRC's intervention.
Thank you very much. Merci beaucoup à tous nos panélistes et à toutes nos.
Thank you to all of our panelists. Unfortunately, Dr. Mwambe couldn't come, but I think he will be there next time. I think we have Marie Gloriose here, who is our regional director and who will be able to give the closing remarks. Thank you, Ramata. As we conclude this second webinar on reproductive health and gender-based violence in Central and West Africa, I would like to express my deep gratitude to all of our participants and to our distinguished panelists for their high-quality contributions to the debates. Today's discussions have highlighted the role of research. We talked about mixed research methods in order to identify the needs and challenges in order to find effective solutions, taking into account the local context to improve reproductive health for all adolescent girls. These discussions have reiterated the importance of a collective commitment, participatory collaboration to bring about positive social change in this area through effective collaboration between different stakeholders at all levels, including communities, governments, civil society, researchers, and international partners. So let's build on this dynamic of fruitful collaboration to advance research, policies, and actions that strengthen the empowerment of adolescent girls and boys and communities in Central and West Africa. As we had mentioned it at the beginning of this webinar is part of a series, and so we will be holding a third webinar after this one that will be organized very shortly. So after the one for today, where we have advanced a few solutions and interventions that all of our panelists shared with us, in this third webinar, we will try to look at the sustainable lessons and solutions in order to put forward concrete recommendations for improving reproductive health and combating gender violence. It will be the last one of the series, and the aim will also summarize the lessons learned from the previous sessions and encourage dialogues between researchers and decision makers in order, again, to improve reproductive health and combat gender-based violence. We will have soon an announcement for you, so stay tuned. So on behalf of all my colleagues, I would like to thank you for your participation. Together, we can make significant and lasting progress towards improving the reproductive health of girls and women, and we can protect them from gender-based violence. I wish you all, ladies and gentlemen, a good day, again, a good evening, depending on where you are based. See you very soon, and thank you again.